Good day, everyone. This is On Air Pharmacist, a channel on Facebook, YouTube, Twitter, and Instagram. Today, we'll be discussing drug abuse and addiction. This topic was as a result of the last topic we discussed, where we talked about overdose and consequences of drugs. One, want to establish the fact that some patients deliberately take overdoses of drugs. Now, maybe for reasons of addiction or for the fact that they are already abused to some of those drugs. So, why do they take these drugs? Sometimes it's peer pressure that leads to it. So some patients you see that they start smoking because their friends actually smoke as well. Some people want to gain some benefits. For example, you want to get relief from stress, so you tend to take the drugs every now and then. Every time you feel you are so stressed and you want to get relieved. Sometimes you want to have increased energy. Some of our laborers out there, some of our busy as chief executives do take some kind of drugs. In fact, as small as caffeine, some people are already addicted to that. So the fact that they take these drugs, it makes it makes it a drug of abuse to them. And then there's the fact that some people want to feel relaxed, some people want to relieve themselves of pains, some people want to escape from the reality of life. So if you take drugs because you feel some incidents that have taken place in your life, you want to forget them, and then you take the drugs, you are probably also an abuser of drugs or addicted to the drugs. Some feeling of more self-esteem pushed some people to taking the drugs, and bodybuilders and athletes have also abused drugs in the past. So even for ladies nowadays, some people do take drugs to get enlarged boats and enlarged breasts. It's also why some people do take the drugs. Um, Physical dependence make people to come back to wanting to take the drugs, and then the psychological feelings they get, psychological dependence they get when they feel, if I have not taken this drug then I'm not fine. It's one of the problem. The very common drug of abuse, you agree with me that there are some that are legal and some they are not, that are illegal. For example, smoking, it is legal in most part of the world, but it's an abuse drugs. So you can smoke cigarettes, you can smoke marijuana, cannabis, and the cracks that we have of this world. So it's an example. And then even some very common ones like the caffeine that we have in our tea, in our coffee that we take, and in some energy drinks that we take. Of course, it has been established that all virtually all energy drinks have caffeine, very high caffeine content, and that makes you know repeated use of it an abuse, or even we can even say those people that use those drugs are addicted. Now, what's the effect? The effect of drug abuse. What's the effect of drug abuse on individuals? There is social effect. One of which is the fact that it causes homelessness in patients, in people. People become homeless. They tend to stay on the street. They do some kind of crimes, very risky behaviors. You find them doing that, and they become very violent. And there are also incidences of road traffic accidents as a result of drug abuse. Of course, the alcohol intake and alcohol and some other um, drug of abuse can have some kind of a psychomotor activity, so they tend to affect your ability to operate machineries. And once you do, that's the more reason why people used to say, when you take drugs or when you drink, don't drive, and when you're about to drive, don't drink. Of course, because it has effect on their ability to be coordinated to drive any machinery. And on medical conditions, medically, the effect is neurotoxicity. It tends to damage our nerves, and by so doing, it impedes the transmission of information from one side of the body to the other side, and that could be very serious. In fact, in some cases, it could lead to um, infertility in men. There's also possibility of one getting HIV. The fact that there are drug of abuse, that you use needles. People use needles to transfer it. Um, there's now tendency for people to use unsterilized needles, which can cause them to transfer from somebody that has used, if the person is HIV positive, and the fact that they could also be involved in some kind of illicit activity, since it results in loss of control when they take drugs. There are also mental illnesses can also come in as a result of drug abuse. Cancer have been attributed to some kind of drugs, particularly maybe the ones that we have to smoke. Depression is a very common syndrome in patients that abuse drug. When they get depressed, there is every tendency of getting suicidal thoughts, and patients just want to commit suicide. We ask them questions, they don't really know why. Anxiety could come in, fatigue, they get so fatigued. And on family and friends, this effect is also very pronounced. Um, marital problem could also arise, where patients would have issues with their spouse just because they are um, directly, just because they are taking drugs. On the other side, maybe because they lose control, they don't even know what they do again, so they become violent on their partner. Poor work performance is also established as one of the effects of drugs. Also, low birth weight to the fetus. If we have pregnant women that do take drugs, they might have their children might be very small, so it's one of the effects. Then society-wide, we have a case of reduced productivity, and then drug-related crime is also one of the effects. Now, um, someone will say even caffeine that we take, the tea that we take, some people are so addicted to it, so addicted. Some people just take Coke. Coke is caffeinated, of course. You would realize that you want to go back and go back and go back and go back. So now, for everything we take, whether you take it's a legal drug or in an illegal drug, we have this tendency of us getting addicted to such drugs. And once you get addicted, the side effects of those drugs become more pronounced in you, because of course after some time they will accumulate in our system and excretion becomes difficult. So how do you know if you are actually addicted to a drug? One is that you must have taken the drug chronically. So for instance, you are such a person that takes the drug and you want to take and take and take, and you have been taking for the last 5 years, for example. That's a chronic use already. And loss of control. Sometimes you take some drugs and you feel like I am actually not in charge of myself at the moment. That feeling makes you an addicted patient to that drug. The compulsion to always want to take this drug. Sometimes some people will say, if I have not taken this thing in a day, I don't feel alright. Then even despite knowing the consequences, some patients still want to take drugs. So if you feel that after knowing that this drug is actually dangerous to you and you still want to take, you are possibly addicted to the drug. And when you crave for the drug, craving could get to a point that people sell their properties, sell their clothes, their everything just to get the drugs. They even go into prostitution just to get the drugs. They go to any length. They go into gambling just because they want to buy their drugs. They sell valuables at a very cheaper price just because they want their drugs, and that is craving. So for all of this, what do we advise when you see a patient that is having all of these cardinal symptoms, all of these cardinal signs? The best for us is for us to align them with an healthcare practitioner that is going to do the rehabilitation for them. First of all, they have to withdraw this drug, but at that, it has to withdraw slowly. So for withdrawal of these drugs, it has to be withdrawn slowly, just like I said. So if it has to be withdrawn slowly, there will be an alternative measures to supplement for what the patient will crave for. So this can be best done by um, a rehabilitator, a health rehabilitator. So you need to see these people once you identify that. For us as people, we need to help ourselves to get away from peer pressure. We need to find our comfort. We need to find our relaxation, our stress-free mechanism somewhere else rather than taking drugs. We need to look for our self-esteem somewhere else rather than taking drugs. We need to build our muscles just doing exercise alone rather than taking drugs, because at the end of the day, the 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 side effect or the dangers are more grievous than even you taking the drugs. Yes, there are soft drugs, there are hard drugs, there are illicit drugs, and there are recreational drugs, but drugs are drugs. The fact that you take them and you want to go back there again to take them makes you addicted, and the fact that you are taking it unprescribed, the fact that you are taking it not according to the dosage or the frequency of dosing or how it should be taken, then you're already abusing the drug. So um, I advise that we become champions of drug abuse campaign from now on. Tell your people, tell everyone around you, the drug cannot make you escape realities. It will only compound your problem. So if you like this video, do like our page on Facebook, on Air Pharmacies, on YouTube, on Air Pharmacies, and then you get a prompt when we release the next video. And do have a great day.